control at the community level, and also make sure that people stay at home for the isolation, and also they have sufficient materials for their daily necessities, and also will put a close eye on monitoring and testing the key groups. As of May 30th, we have accumulated number of vaccines administered 639.172 million doses, and we also make everything we can to push forward the administration. And every day we give a 1.247 million doses per day. That's 2.58 times of the daily doses we gave in April. And we're trying to always promise that we would like to make the vaccine as a global goods. And so far we have donated 300 million doses of vaccines, make sure it's accessible and affordable for people around the world. And also in today's press conference, we will continue to talk about the issues related to vaccines. With us today, we invite Mr. Cui Gang from China Health Commission, and also Madam Jing Jing from Sichuan Province, and also Mr. Feng Zijian from China CDC, and also researchers Mr. Shao Yiming from China CDC. They will answer your questions. Now the floor is open. Please identify your media affiliation before asking questions. Thank you, Xinhua News Agency. There's comment online. It's not force people to be vaccinated, but we still can see that it's a one-size-for-all measures taken in certain places. How we can prevent this situation happen? Thank you for your question. Followed the decisions of the Central Party Committee and State Council. We right now, on the basis of a well-ordered manner, we give the batches of vaccines to the people. And also right now we could see that we also accelerated the speed of vaccination, as our moderator just introduced. We have seen that the effective measures have been taken in places, make sure that the work of vaccination could be processed in a well-ordered manner. In certain places, we still found that there's room for improvement. And so the one-size-for-all measures also been practiced. Not long ago, National Health Commission has made several requirements in order to prevent this kind of situation from happening. And for localities, they need to correct the wrongdoing or potential loophole in this area in order to further improve the capability of management, and also to screen out potential risks. And we need to make sure our work can be conducted in a meticulous manner. Going forward, National Health Commission will continue our efforts to give guidance to localities, and also we will do a project-based practice manner. We not only focus on the quantitative level, we also focus on the quality level, make sure that people can improve their sense of gain and happiness. It's China Network. Sichuan with a large number of population, and also the mountainous terrain. So what measures do you have in place to make sure that vaccination can be carried out in a smooth manner? And what do you have in place for the going forward plan measures? Thank you for your questions. Sichuan has a large places ranking number 5, and we also have 80 million residents. And it's also distributed unevenly. We also have a mega city in Sichuan province, and we also have places actually not really convenient to reach. Therefore, we need to think in a coordinated manner to carry out our vaccination work. And Sichuan actually did a second batch of vaccination work. As of 12 o'clock today, 28.35 million vaccines have been administered. May 22nd. On that single day, we given 2.1 million doses on that single day. So we have taken several measures. We have the special teams to conduct the supervision work, and also the local health commission also sent the specific team to give the guidance at each center. And we also have the working teams at each large base vaccination places, and we also have the team at the local community level. And we also work with different departments, including the public security department, to make sure that the vaccination order is well guaranteed. And we have two kinds of the vaccination places. One is the irregular long-term base for vaccination. Another is the ad hoc or the mobile vaccination places. And we also hear the feedback from the public, and also for the people, if they not feel well after vaccination, we also have a special health team to give the on-site treatment. We also have a video clip actually that's also going viral online, and to ask people to get vaccinated. That's very popular among the population. So people, if they get vaccinated, the app will be also received a special feature. So that could be the element from Sanxingdui ruins, or a panda, or something remarking as Sichuan features. For the transportation of vaccines, we also well planned, and for Liangzhou County, actually the ODA vaccines actually well planned it, and also for the transportation, they will be guaranteed and also patrolled by the police cars, especially during the evening. So we shortened the transport time needed. So far, just need 2 days. So where the need are, we will always transport vaccines to the needed places. So we have 2 leaders in charge of the vaccine places. The one leader in charge of the arrival of vaccines, another leader in charge of the green passes available to the special group of people, including the silver and elderly people, and also for the large populated places. We also have set up a special vaccination places near their community. All in all, what we are doing here is we not want people to waiting too long, and we also bring all these facilities near their location. And we will, going forward, improve our service and also have a plan in order to carry forward the vaccination schedule. CMG. We have found that the cluster infections reported. So we really tightened the imported cases, but we still found that the variants imported to the local places. Does it mean that we need to improve or increase the level of response? And because we will very soon have a Duanwu holiday, and what measures do you suggest to protect the public? Thank you for your question. Indeed, we have seen the reported of a local infections, which means that we're still facing a very strict situation in terms of fighting against COVID-19. So we need to continue to practice the protocols of fighting COVID-19, and we should not drop our guards because of no infections reported. And we also carry forward the vaccination in a faster speed, but that doesn't mean that we already reached herd immunity. Therefore, we need to strengthen our efforts and also stay alert to make sure that we prevent the important cases. Regarding the imported materials and also the inbound people, for the people that have direct contacting with all these imported materials or inbound personnel, and they are the key group of people, no matter they're vaccinated or not, they should receive the NAT on a regular basis. So their health condition always under our control, and all these can help us to lower a risk of the local infections. And this is actually also one of the key measures for us to curb the spread of the virus after the outbreak in Wuhan. And it's a learning curve for us. We may always find the new situations or new problems, so which ask us to always stay alert and stay vigilant. So we're talking about important infections, no matter through products or materials or people. So far, we reported 30 cases. Every time, the way of the infection, the way of the spreading actually is all different. So that's always give us a new knowledge. And in recent days, the local transmissions in Guangdong, Shenzhen, is all caused by imported infections. So in Shenzhen, that's the B117, the UK variant. So the UK variant actually is more contagious than the virus we knew before. And in Guangzhou province, the cluster infections actually caused by B617. It's also UK variant. So these CA2 variants actually is more contagious. So B117 is 30% more contagious, according to the data showed by WHO. And Indian variants B1672 is the 100% contagious, more than before, so which actually impose new challenges to our work. So when we take actions against COVID-19, we should be determined, and based on the new situation, we should use the tools in our toolbox well and in an effective manner. In terms of a scope, a time period of using these tools that should be adjusted based on this new situation. As you mentioned, the upcoming Duanwu holiday Our suggestions actually are more or less the same as the previous national holidays. So for each person, we should protect ourselves well. So keep your personal hygiene, including wear masks and hand hygiene. And so we talk about the people in the medium and high risk regions. We not encourage people to conduct travels. So that also can help lower risk of cross-region transmission. And if people show the symptoms in their respiratory systems, and we also suggest not conduct any travel. So if you show any symptoms, please visit the hospitals with fever clinic. So this is our key suggestions. Thank you. Thank you. With CGTN, as you mentioned about the variants, as we noticed that the experts said that the homemade vaccines are actually still effective to deal with the variants. So we talk about effectiveness. Do you have any number to back this statement? So today we also invite Mr. Zhang Yintao. From the Sinopharm. Thank you for your question. And yes, indeed, for our phase 3 clinical trial, we got a serum, and we also use that serum to check with the variants and also look at the strains of the variants from India and UK. So far, actually, that can have a good effect with the variants. So we could tell that the vaccine still works and also can protect the people. And we talk about the variants, actually, that's naturally happened. As long as the variants could be controlled, then the vaccine is still effective to protect people away from the virus. And the inactivated vaccines that can provide a high tolerance to the variants. And we also actually make sure ourselves get ready to deal with a new variant. So we can develop the vaccines for the variant strain. And actually, that a newly developed the variant strain vaccines actually also can just add on to the existing vaccines. And from last year to this year, we also have a smooth system for approval and also the development and the production. We have the strict standard in place. So far, it's all in the process. So just a variant strain have been found, and we also can have the updated variant for people. Thank you. BTV. My question regarding the vaccination work for the key groups and key regions, and how we can make sure that people can get their second dose on time. For the vaccination in China, taking the consideration of disease prevention and control, our work focuses on two parts. One is key regions, including coastal cities, cross-border cities, the medium and large-sized cities. And the second one is key groups, which means people have a high exposure to the virus, like the health personnel, the social working people, and people working for nursing home, and people working for the public sectors. So we talk about the two key focus. So by the different batches and by different steps, we have carried out our vaccination work. As of yesterday, so far we have administered more than 639 million vaccines. I believe till today we already surpassed the number to 640 million vaccines, doses of vaccines. So right now we have the three technology involved in our vaccines. The most used one is inactivated vaccines, which require 2 doses. In order to speed up our endeavor in vaccination, National Health Commission has always put key focus on inoculation. In order to guarantee that people can get their second shot on time. And we have dispatched a special working team to 31 provinces and the Xinjiang Production Corp. And we also well calculated the demand of the second jab, and we also leave enough the lead time, because that we need to give enough time for transporting the vaccines in order to make sure that we fulfill the needs of the second jab. Going forward, we will strengthen our work in giving more guidelines to the localities. We not only focus on numbers, we also focus on quality. Thank you. Thank you. It's Hong Kong Economic Herald. So starting from the day one, we planned the 5 technologies. Some of the technology already right now transferred as the vaccinations. So vaccines, I would like to ask about the remaining technologies. Thank you for your question. Yes, indeed. At the onset of the outbreak, we planned the 5 the technologies, including inactivation and the mRNA and adenovirus. And we also have the emergency used one, that including a protein vaccine, and also the vaccination vaccine from different companies. Make sure we have the more choices. And we also have 2 other technologies. So one is mRNA, another is like a fever vaccine. So the fever-like vaccine right now already passed a phase 2 trial, and right now we contact the overseas countries for the phase 3 clinical trial. And for mRNA, it's already approved by the animal examination. And we also contact the overseas countries to carry out the phase 3 trial. Thank you. Thank you with CMG. Regarding taboo of vaccination, so people still have some hesitation, especially people like in their lactation period or people in their period, whether they are good enough to be vaccinated. Thank you for your question. No matter if the vaccines for COVID-19 or for other disease, they all have certain taboo, and we talk about some are the common things, but based on the different vaccines, they also have some differences. For the people not good to be vaccinated, so the first, people allergic to the vaccines, or they have that vaccine history before with other vaccines. And second is people show that the vaccination symptoms after they got their first jab, and people in fever or right now in the acute illness, so they are not good to take vaccines. So we're not really seeing that people show any side effect, but still, based on their full consideration, we have listed 5 groups of people not good to be vaccinated. And we talk about if people with the acute disease or their chronic disease, but right now in acute situation, they're not good to be vaccinated. But if their disease are well eliminated, then they could be vaccinated. But for people that they show a severe allergy after their first jab, then they are not suitable to get their second jab. For women in the lactation period, or women in their period, they good to be vaccinated. For people with certain disease like the depressive disorder or other disease, they should ask the clinical doctors for the decision making. So when you going to be vaccinated, you need to first talk all these information regarding your allergy history and also the pharmaceutical measures you are taking, and you should report that all to the doctors before vaccinated. Thank you. With CRNTT. And we have the vaccines in the market with 1 dose, 2 doses, or 3 doses. So what's the differences among these three? Thank you for your question. Indeed, we have seen more vaccines are in the market, so people have more questions regarding different kinds of the vaccines. So I would like to explain a little bit about these 3 kinds of vaccines. So far, we have activated vaccine, the vector vaccines, and also protein vaccines. So talking about the methods and other productions they have based on science. So the inactivated vaccines, this first inactivate the vaccines and then produce antibody. So far, the inactivated vaccines are very safe because they have been practiced more than 100 years and have a limited side effects and just need to store it at 2 to 8 degrees Celsius. So it's very easier to be transported and stored. So for the first shot, it helps to first induce immune cells, and the second is to strengthen the immune cells in the body. And the second vaccine is the various vector vaccines. So they put that the S virus inside the body, so it's very effective. So normally just 1 jab is enough for the vector vaccine. So for people in emergency or in special need, this is a quite fast way to build up their immune system, immune response. For the places with lack of materials, so they do not have enough material for 2 or 3 doses. So just give 1 jab, then the whole places could be with the herd immunity. And for the aspartame, not injected in engineering cell, so that's the protein vaccine. So normally it requires 3 doses. So after all these 3 doses, they will reach the best immune response. No matter which vaccine, they are the safe, effective, and reliable one. So no matter it's 1 dose, 2 doses, or 3 doses, they all passed the verification in phase 1, phase 2, and the phase 3 clinical trials. So they already passed all the process. So no matter it's the 1 jab, 2 jabs, or 3 jabs, it's all meet the requirements domestically and internationally. So people can set assured to choose no matter which vaccine you would like to be vaccinated. But I also would like to emphasize 2 things. First, the number of doses actually based on science in order to reach the best result. So the public need to finish all the doses required. If it's 2 doses, you only take 1, or 3 doses, you only take 2, then that cannot reach the best effect or best result. So that cannot really keep you safe and also keep you away from the infectious. And second, based on the actual practice in many countries, if we not reach the herd immunity, we cannot drop our guard. And we very glad to see that the people that's here today are friends from the media all wearing masks. So right now we speed up our vaccination process, but we not reach the 70 to 80% of the people got vaccinated. That's the herd immunity threshold. So we need to take 2 measures. First, vaccination, and at the same time, need to wear masks and keep your hygiene. And if we reach that herd immunity, we'll have the new protocols to be introduced. With Phoenix TV. So we have seen a higher frequency of the new vaccines happened and also become the main vaccine or the strains in other countries. We also found these new variants in China and how we can prevent the spreading of the new strains. For the new variants, globally, we have established that monitoring network. And also WHO also established a special team to evaluate the key features of variants. We look at the infectivity and also the pathogen of the variant, and also that immune response to the new variants. These are all right now under close monitoring. For the research team in different countries, we're also putting close eyes in this regard. And we also talk about that vaccines. We have different technologies involved, different R&D actually all going on to tackle the new variants. And the WHO believe that although the new variants is stronger in infectivity, disease prevention and control measures suggested by WHO, and wearing masks, and keep social distancing, and keep your hygiene, and keep ventilation, and also the tracing and also the isolation, lockdown at certain community levels. All these actually are still in place. We need to stick to all these. Nothing changed. We talk about the scope, the time period of practicing all these measures, and also the intensity. All should be based on the new situation. Thank you.
好，谢谢，请继续提问。我们来请右侧区第2排第3位男记者。
好，谢谢主持人。这个问题我们想请教静静女士。四川成都的
Question to 静静。
是我国中西部最大的航空口岸。
A question regarding the Shongliu International Airport. That's also the one of the biggest airports in the southwest city, and also quite closer to the ASEAN countries. So, what kind of measures in place to prevent the imported case? Yes, indeed, as you mentioned, that the Shongliu International Airport is one of the biggest airports in the southwestern places. The air traffic in Shongliu actually is ranked number 2 in China. So far, we managed 6,000 passengers and 340,000 inbound and outbound people, and we actually screened out 800 infected personnel. And we also focus on 2 key parts. So first, we have the special team to deal with the information, the international flights, So that including the transport of inbound passengers, also the information sharing, so in the closed circulation of our work.
其他的20个市州呢是枝干，183个县区是终端，人员要做到闭环转运，各个节点要做到有机的衔接，对病例首站入境的人员、解除隔离的人员。
So for the people that we have the chartered transportation, make sure that they all transported in this closed loop. Sichuan actually also established the information sharing system inside the Sichuan province, and every day we will share the information in a timely manner, make sure that the seamless communication system, and we also strengthened our capacity. And first, we have the expanded the space for the examining and testing, make sure that we're good enough to accommodate 1,000 people to get their NAT in the airport, and also within 2 hours, we transport the inbound passengers from the airport to the isolation places. And also for the cold chain products, that's imported products, and make sure that everything is traceable, and also we will do the disinfectant as needed. And we also crack down the illegal import of the cold chain products. And also third, we also have the system for quickly carrying out the epidemiological investigation. And also for the hospitals, we also strengthen our efforts regarding treating patients, and also the patients discharged from the hospital, and also for the in the hospital disease prevention and control practice. Thank you.
请右侧区第3排第2位记者。
谢谢主持人，中央广播电视总台国广进行提问。今日个别地方发布公告称，6月9日前
China National Radio
接种第1剂次的新冠疫苗，之后呢，为了保障第2剂次人群的接种呢，要暂停第1剂次的接种。那么就有群众会担心啊，6月9日
There's the saying that the June 9th is a milestone, that till that day we should finish the administering of the first dose of vaccines and started the second dose, and which means that after June next, that we will not give the first dose to the public, and that also means that the vaccines will not be free of charge. So as we introduced many times, that our vaccination work actually carried in different stages. So far, the vaccination work based on the need of disease prevention and control, supply of vaccines, and are scheduled. So that's based on the different batches, and also with our key focus and free of charge. These are the key principles.
分步骤的对各类人群开展接种，为保障大家能够按时的完成
In order to ensure that people can get their 2 doses of vaccines in order to be better protected. So based on the technical plan,
对我们的整体接种工作呢进行了统筹的安排。
in the recent days, we also
6月
have
10号到30号
made the integrated plan of vaccination.
6月10号到30号呢，
So June 10th to June 30th,
接种过第
where
1剂
people already had their first jab,
集中开展第2剂的接种。
they will receive their second jab.
对于 有特殊需求，
But people with special needs, for example, they need to conduct overseas visits or the disease prevention and control requirements.
7月份以后，我们会继续的全
We'll
面
also give a normal vaccination. So in July, we will continue our work
有序
in
的
giving the first jab or second jab.
介入。另外呢，也建议大家一定要不信
So our suggestions is people not buy in the rumors and also not fabricate and spread the rumors.
好，我们请左侧区第2排第2位记者。
谢谢主持人。中国日报记者提问。近期
With China
SARS
Daily
发表了一个研究文章，证明了戴外科
Journal Science
可以阻止新
issued a
传播。
article suggesting that wearing surgical masks that can prevent the spreading of COVID-19. So we know wearing a mask, and especially at the onset of COVID-19, is one of the suggestions for the public.
回答这个问题之前呢，我想把刚才那位记者提问的关于变异病毒发生之后，这个国家这个防控措施如何加强应对，再补充2点。
Thank you. Before taking that question, I first like to say something about the new variants. So what kind of measures we have
新冠疾病的它发现的能力，及时发
to
现。
tackle the new variants? First, we have the data monitoring system, so that will help us to screen out the new variants.
薄弱缓解需要去加
So
强。
we still have room for improvement in this regard, especially the infected people
医疗机构
visit the hospitals or the clinics at the community level.
诊所的医生，
The doctors
基层的医院，这个卫生服务中心的我们医务人员呢要
the health personnel, they should always stay alert. If the people with the respiratory symptoms visit your clinics, you need to report to the higher hospital agency and also transport them to the different clinics. Make sure the potential infected people can be detected and reported at an early date.
暴露出来一些问题，在今后呢，我们要尽可能的
I believe this is the loophole we found in the previous practice,
早期传播另一方面呢，也是
and it also help us to curb the further spreading of the virus, and also help us to find the potential transmission as early as possible. And regarding
场所那个设施里
the
医疗
places,
这个
especially
入境
hospitals,
人员、入境感染者的定点就诊医院
the hospitals receiving imported
更加严格的、
passengers,
更加严密的
we should practice more stringent
这个防治
disease and prevention control
设施上
measures
在工作流
for
程
the
上
facilities,
各项
the working
感染
process,
这个措施的落实的细节上
and
下
the implementation of all these measures should be further strengthened.
特别是在这个病毒变异、传染性、传播能力比病毒增强的这样
Especially given the background of the more contagious variants.
更细致、更扎实。刚才这位记者提到这个问题呢，是这个我们在
And back to your question,
的过程中，会这个需要去讨论和思考的一个非常重要也有意义的问题。正如我前面呢所提到的，新冠呢是一种新发传染病。
COVID-19 is a new coronavirus disease, and we keep learning
一开始就对它的各方
about this new virus.
获得准确的
So it's impossible for us to get a full knowledge of this new
有些呢
virus.
在早期在不确定的那些问题呢，在后期
So for the uncertainties at the early date, we may find the answers at a later stage. But from the infectious disease prevention and control practice, we cannot wait for the answers to all the questions and then make decisions.
证据不完备
So
情况下呢，
a lot of situations that we need to make decisions based on the limited evidence and based on our previous practice and knowledge to make the final decision. So for the COVID-19, a stringent disease and prevention and control measures are effective and needed to
好，谢谢，请继续提问。
protect people's health. Thank you.
左侧区第3排，发布到第1位记者。
谢谢主持人，中国青年报记者提问。
What is China use?
呢想提给静书记。那2021年的
A question to Jingjing, and we know that the college entrance exam are now counting down. What measures do we have to guarantee the smooth carryout of this big day? And this year we have around 700,000 students, and we have around 350 venues for the exams.
抓重点，多演练，努力呢能够做到不让疫情影响高考。
So we make sure we not let the vaccines or we not let the disease to impact the entrance exam, and also we had the early planning that involved many different departments, including the education, the public security, and also the health commission. So make sure each places we have a special team, we have people know their roles and responsibilities. And right now we have around more than 5,000 people deal with the health issues. So for the staff, and all vaccinated. And also the 14 days ahead of the examinations, all the students and the staff, the health conditions all under monitoring. And we also have a special channel and places to deal with the emergency situation, like the students showing the symptoms. And also for the all the environments, surrounding environments near the exam places, as right now also under the monitoring, and also we conducted the disinfections, and also we had the several rounds of the practice, make sure all the situations actually is in our consideration.
好，我们来请右侧区第4排发布到第1位穿黄色 T 恤的男记者。
好，谢谢主持人。红星新闻记者提问，我们的问题也提给四川卫健委。
With bright stars.
在常态化
Our
防控
question
中，
also
四
go
川在
to
外防输入、
Madam
内防反弹
Jingjing.
方面成效显著。请问四川在疫情防控方面主要采取了哪些举措？有什么经验可以分享？谢谢。
What kind of measures have you taken effectively
谢谢您的提问。
dealing with imported cases?
高度重视我们常态化疫情防控的工作。
The Central government attach great importance
应对小概率可能会出现的事件。
in disease prevention and control.
方面，第一个，首先是指
We have done the
我们
following.
要求指挥体系要保持上
First,
下烫，什么意思呢？就是要坚持3个坚持。第一，要坚持平战结合、快速转换，坚持常态和应急的及时转换机制。
is that we focus on both the emergency response and also the regulated disease prevention and control measures. And we also involve the high leadership involved, and also have the daily reporting system. And third,
我们就是省级统筹调配防控和救治的资源，市级侧重流调溯源，患者的集中救治。
the provincial level in charge of the material, the mobilization allocation, and the city level deal with the epidemiological investigation, and the county level focus on the potential cases.
主要有3个方面，第一个，核酸检测能力要强。
We improve the NAT capacities, and we have the centers at the provincial level and also city level. Right now, we have 928 agencies who carry out the NAT, and also have the regular quarantine places
那么24小时
We right now have 80,000 rooms, and they could be used within 2 hours. And we also have the 16,000 rooms as backup.
我们全省有接种台是1.6万个，每日接种的能力呢是230万剂次，能够做好准备。
And we also actually prepare ourselves to give a large
严抓规范。
number of people vaccination, and our daily capacity of vaccination is around 2.3 million doses.
8万多个，各级各类，在全国是排到第2位的。其中，基层医疗卫生机构和社会化办的医疗机构在全国是排第1位的，量大变宽。而且呢，
In Sichuan, we have around 80,000 hospitals and vaccines distributed in different cities and county levels. So we first do everything we can to establish the fever clinics. And regarding the patient with fever, I also have the standards in place to better manage these group of patients. So they should first be register their information, and also we should report the patient with fever to the Health Commission. And we also focus on the hospital infection control, and also we conduct a dynamic study in the situation of the infectious, and we also have changed our practice based on the dynamic situation. And if we found the locally transmitted cases, we will also initiate our emergency response, and also people should arrive on scene as early as possible to curb the spread of the virus. Thank you.
好，我们来请右侧区第4排第2位男记者。
谢谢主持人。东方卫视记者提问，想请问一下，面
Oriental
对大
TV.
规模的疫苗接种和日常
Regarding the last scope of the vaccination, how Sichuan use the information technology to help you to facilitate people
继续请静
being vaccinated.
谢谢这位媒体朋友的提问啊，我们非常重视啊，省卫生局非常重视能够科技赋能疫情。
Thank you very much.
所以较早的
We always
四川建成了1码2系统。
believe that technology can empower
2系统就是核酸
our
检测
work,
信息系统。
and we also use the information system to help us to better manage information. And we have the QR code or green code,
信息自动匹配。
and also we make sure that the services can be dealt with via one code, and just the public use the cell phone so to check
和新冠疫苗接种的情况。
their vaccination process.
大数据
And we also base on the big data,
能够做到人苗匹配精准到接种点。
and we can actually people to go to their nearby vaccination places.
企业、开发公司等等一起。
And we also worked a big data company to establish a working group with more than 100 people involved to make sure that any issue happened just within 15 minutes that can be shoot.
进入了核酸检测系统。免疫规划
And right now, all the people, their information of vaccinations, all right now is available online.
好，谢谢。时间关系，
Due to the interest of time, two last questions, please.
好，我们先请左侧区第4排这靠边这位男记者。
好，谢谢中新社记者提问。我
The
们看到
news
中疾
agency.
控前一阵儿在网站上公布了这个疫
So
苗
at
接
the
种不良反应
CDC's
还是想请专家
website.
就是疫苗不良反应到底指的是什么？为什么有
And
人
you
接种之
have
后
the
会发生
mention about the adverse reaction of the vaccination. Could you please talk more about that? Why people show that adverse reactions
疫苗
after
不良反应
vaccinated?
是
Thank
疫苗
you.
本身的特性引起的，与受众者的个体差异有关的。
So the reverse the response actually based on the people's
非预期的
health conditions, so that should
包括
be
一般反应，也包括
look
非常反应。
into case
一
by
般反应呢，
case.
主要是指
So the
疫苗
normal
本身
response
特定
is
引起的
because of the a certain
发热
vaccine. We talk about the fever
这些反应呢，
or the a swallow or ride and swallow. So you do not need the additional treatment. So it could be cured by itself.
异常反应呢，主要是指造成受众者组织器官或功能损害的不良反应，往往
And we talk about the
病的
abnormal reactions, so that require the
罕见
additional
发生
treatment.
它发生的比较非常罕见，
It's really rare
严
happen.
重的过敏反应，
We talk about the a severe,
发生
the
发生率非常。
allergic response.
疫苗接种后呢，在诱导人体免疫系统产生对特定疾病保护力的同时呢，由于疫苗
So after get
本身的生物
vaccinated,
特
that the
性
immune response
受众
actually
的
been
个体之间的
induced.
确实有少数受众者呢在接种后
We do
发生不良反
find that the
一般我们在说这个
certain people showed the a adverse response after
疫
vaccination.
苗的质量
We talk about that's not because of the quality of vaccination or the a wrong way of getting vaccinated.
一个生物物质进入人体以后产生的这样的
So that because that the
非预期的反应，它发生呢是非常罕见。
the foreign subjects actually entered the a body, and also that the a certain individual show that the a adverse response to that the a foreign substance.
我国疫苗接种不良反应的监测
People's
水平
Daily,
和是否
and we would like to ask about the a standard of monitoring the adverse response, whether that aligned with the global practice.
我国的谢谢你提问。
Thank you for your
我国的疫苗接
question.
种反应不良反应监测
Regarding
工作
adverse response monitoring,
2005年
we started that work in 2005, and that's developed really
随着
fast.
工作的开展深入，疫苗不良反应监测
With
水
more
平
work carried out in this regard, our work have much been
分
enhanced,
别通过了世界卫生组织对我国国家疫苗
and
监
we
管
have
不
passed
良反应监测职能的评估，
the evaluations conducted by WHO.
都达到或超过了世界卫生组织
So our practice and standards either same or even surpass the standards set out by WHO. And this time, actually, we have the unprecedented scope of people getting vaccinated. So we also touched the greater importance to the vaccination and also the adverse response.
提供这个各种各样的
We not only provide
服务的这个队伍以外，我们还
the different services,
不良反应
we also strengthened our monitoring system regarding adverse response. The
安排专门人员
CDC and the local departments all in charge of collecting data and evaluating the data regarding the adverse response. The national CDC
20个人
had a group of 20 people to look into the data day and night, to make a further analysis,
安全信号
as well as
信号的这个探测，然后评
it
估，
detects
发现任何有异常的话都会
the potential
国
risks.
内部，包括和国家药监局的药品不良安全中心的
And we also work
会商进行评估。
with the national, the Food and the Drug Administration.
我们国家现在上市的
So there's no evidence show that the commercialized vaccines show any issues. So it's very safe and effective. Thank you all the speakers, and that's
台下就坐的几位嘉宾
the pressers. And our guests actually introduce about the disease prevention and control work and also the vaccination process. And we will also keep all of you updated to answer your
今天也是
concerns.
第34
And
个
this
世
is
界
also
无烟日， 也让我们一起
also
承诺戒烟共享。
the non-smoking day. That's also the day to promote the non-smoking. Thank you all.